I am Dr. Mona Desai, President Ahmedabad Medical Association. As you all know, in these times of pandemic, that is COVID-19, we all are suffering from real panic state. And we are seeing day in and day out that all the doctors and health workers are risking their lives and going out in the field or going to the clinics and hospitals to treat the patients. And what do they get? Do they get any appreciation? No. What they are getting is, they are getting all the animosity from all the people. So many places in India, we have seen that doctors are not allowed to enter their own houses or own flats or own society. Is that right? Is that humanitarian approach towards the people who are saving your life? I think people, now it is time for you to change your thinking. Don't panic so much. Coronavirus is not so bad. The only thing is, you people in this panic state are just losing your mind and your humanitarian values. So please, nowadays, now we doctors are not going to tolerate this kind of violence, and we request government to take strict actions upon all those people who are injuring or doing any harm to the doctors or the health workers who are going in their clinics or in the field to take care of this corona people. In the protest of this violence, 22nd of April, that is Wednesday, is going to be a white alert day for all of us. IMA has declared this day against the violence against doctors. We all doctors are going to wear white aprons and light a candle at 9 p.m. at night in our hospitals or at our home. This is in protest to violence against the medical fraternity by the lay people. 23rd, that is Thursday, is declared by Indian Medical Association as the Black Day. And on that day, all the doctors will be wearing either black ribbon or black badge in the protest of violence against doctors and doing their practice. So now it is time for even government to support us, because unless doctors are there, they will not be able to fight this fight of coronavirus.
I am Dr. Sudhir Shah, Professor and Head of Neurology and Senior Consultant Neurology at Ahmedabad. I am seriously disturbed and perturbed with the incidences of abuse, violence, and also restricting the doctors from entering their residence, and also humiliation. When doctors are treating the society and sick people with the best of their efforts in limited resources while risking their own lives, at the other hand, there are some nefarious elements which are treating doctors in such a bad way. This is not at all done. Government should make strict laws. At the same time, good people, public should take proper actions against these people. I really request all of you to take active participation, help doctors, save them, give them proper prestige and give them honor.
I am Dr. Tejas Patel, cardiologist at Apex Heart Institute. I ridicule the violence which has been noticed against the doctors in this difficult time of COVID pandemic. I request all the citizens to help us and to cooperate us in our work. All the doctors, nurses and the infrastructural staff is working very, very hard for all of you, for every single life. Everybody is working very hard, and I expect all of you to help us during this time.
Hello everyone, I am Dr. Madhu Desai. I appeal you all not to clap or slap for doctors. Corona is our common enemy. All of us have to fight unitedly. We must help government, who is doing commendable job to fight against this corona, and let us join together and defeat our enemy. Thank you.
I am Dr. Jyotindra Pandit, orthopedic surgeon. The violence against doctors, paramedical staff, nurses should be absolutely condemned. it's a very, very bad happening in our society. These are the soldiers of today and tomorrow. We are damaging the nation by damaging their property, their health, and their residencies. This should be totally stopped, and the persons who are responsible for this violence should be totally condemned and should be punished as early as possible.
Hi
Thank you.
friends, this is Dr. Mahendra Narwaria, Chairman of Asian Bariatrics and past President of Obesity Society of India from Ahmedabad. We are facing through a bad situation of pandemic COVID-19, and our doctor friends are working day and night to treat these patients. At the same time, we are hearing a bad news from all our country on the violence on this doctor and paramedical staff, which is very, very bad. We should increase their moral and help them instead of doing violence on them. The government should take care of it. That is what I want to convey to you. Thank you.
Hello friends, I am Dr. Bansi Sabu. Currently I am President of RSSDI, which is an association of diabetologists across the country. I strongly condemn the violence against the doctors. Rather, we should make a rule to protect them, and there should be a protection from police as well as the government. And we should also do some legal activity against those who are creating this violence. This is very, very important, and we should all try to save our patients as well as our colleagues from India. Thank you.
I am Dr. Shefali Desai, a breast surgeon. I am here to express my utmost disgust and sorrow over the atrocities towards the doctors and the medical fraternity in the last few days. We are out in the society to save lives. At what cost? At the cost of our own lives and sometimes the cost of our own family. And what do we get? Pelting by stones, rudeness, ostracizing, and sometimes even improper treatment if we ourselves are admitted as patients. All that we ask for is a little bit of cooperation so that we can save more and more lives. And in spite of everything, we promise to work selflessly, relentlessly, and incessantly. Thank you.
Dear friends, this video is for protesting against the violence against the doctors. As we know that in everyday newspaper you are reading that this doctor is hurt here, this doctor is hurt there. But as we know that we are there to save your life, we are there to serve you, and we don't want your claps or any medal for serving you. But we don't want anybody to hurt us also. We don't want your stone or your lathi to hurt us. We want the government to make a very severe rule against those who are punishing the doctors or who are hurting the doctors, so that everybody should realize that the doctors are to serve the society and not to get hurt. Because if you are hurting us, you are suffering yourself also. And if we stop serving the society, society has to suffer a lot. That is why we want our government to make such a rude and such a huge rule that everybody should realize that before hurting a doctor, he should think 50 times to hurt a doctor. And we will want a very good support from the government authorities also when our doctors are getting admitted to the hospitals. Thank you so much.